Okay, I'm going to try this again. I actually have already done this once, but mine was about a 19-minute video, and YouTube would not download it because it has a maximum of 10 minutes. So I will be talking a lot faster and omitting the 16-question post-test that I went over. Basically, upon talking with my coworkers, I determined that the need was there for an educational in-service regarding medications. Therefore, for my senior project, I decided to do an in-service on medications commonly used in the treatment of high blood pressure and heart failure. And for my educational program, I basically put together a self-study packet and a 16-question post-test with an evaluation form on it. About a week after I gave out the self-study packet, I went around to my coworkers and talked to them about the post-test answers and answered any questions they may have regarding the in-service they missed or the self-study packets they had went over. I got really good evaluations back from everyone. The information that they used or that they learned, they have actually used in just the last several weeks since getting the information from me. So without further ado, I'm going to go ahead and quickly go through my self-study packet, which is my educational program, on the medications commonly used for the treatment of heart failure and high blood pressure. First are ACEs, angiotensin-converting enzymes. Inhibitors. What those are, basically it inhibits the angiotensin 2 from converting, angiotensin 1 from converting to angiotensin 2, thus reducing blood pressure. It also slows the heart's remodeling and decreases the oxygen demand and the workload of the heart, therefore it's used in the treatment for heart failure. What they do is angiotensin 2 actually causes the body to release aldosterone and vasopressin. Aldosterone and vasopressin causes the kidneys to retain sodium and fluid. If you're blocking this, therefore you're inhibiting the conversion of angiotensin 1 to 2, and kidney failure is prevented. That's why it's used commonly for the treatment of kidney failure with diabetics. Examples are captopril, enalapril, lisinopril, quinapril, lamopril, benzapril. All of those end in pril is the common theme here. Side effects are hypotension, fatigue, a dry hacky cough, and angioedema. We see a lot in the ER. The dry hacky cough will eventually go away if the patient can tolerate it long enough. Angioedema, they have to be brought into the emergency department. We give them IV steroids and Benadryl. They are taken off of the ACE inhibitor. That could happen anytime during their therapy when it's first initiated to 2 years, 5 years, 10 years down the road. ACE inhibitors can cause hyperkalemia, so patients need to avoid salt substitutes which are high in potassium and potassium supplements themselves. However, the potential hyperkalemia is used as a benefit when a patient is put on a loop diuretic, such as Lasix or Bumex, because those can cause hypokalemia. ACE inhibitors are not used in patients with renal artery stenosis because in renal artery stenosis, angiotensin 2 is the only thing that exerts enough pressure on the kidneys to filtrate. You would not want to block that because then you would basically have kidneys that are not being filtrated. Treatment for overdose is treat heart arrhythmias, gastric lavage, and with any gastric lavage you want to premedicate with atropine to prevent that further bradycardia, and charcoal and fluid resuscitation. Calcium channel blockers is the next classification. It's used again treatment of heart failure, angina, and for abnormal rapid heart rhythms. Calcium channel blockers work by reducing pressure in the arteries and disrupting movement of calcium in and out of the cells, producing vasodilation and decreasing oxygen demand of the heart. Examples of calcium channel blockers are verapamil, diltiazem, amlodipine, felodipine, nicardipine, nisolipine. Now most of them end in the word pine. Is an easy way to remember. Calcium channel blockers, Norvasc, this calcium channel blocker, amlodipine, has very little effect on the heart rate and contraction, so it is safer on patients with heart failure and bradycardia. You would not want to try to inhibit the contraction of the heart when you are treating heart failure, but Norvasc has very little effect on that. Whereas verapamil and diltiazem can worsen heart failure because they have a greater effect on the heart and they reduce the ability of the heart to pump blood. Verapamil and cardizem have greater effects on the heart, so they are used when the heart is beating too fast. AFib, aflutter, SVT, supraventricular tachycardia. Calcium channel blockers are not as effective as ACE inhibitors in preventing kidney failure, although they are effective somewhat. Signs and symptoms of side effects: hypotension, constipation, weight gain, and fatigue. Grapefruit juice should not be used within 2 hours before or 4 hours after a calcium channel blocker is taken. Grapefruit juice, because of its acidity, will increase the serum concentrations of the calcium channel blockers, so the patient should be warned not to use grapefruit juice with these. Treatment for overdose, IV calcium for arrhythmias. IV glucagon, the reason we give glucagon is because the heart has glucagon receptors in it, and when you give glucagon, it stimulates the heart to beat and improves bradycardia and hypotension. Gastric lavage and charcoal. Beta blockers, used for treatment of high blood pressure, heart failure, and abnormal heart rhythms. Beta blockers work by blocking norepinephrine and epinephrine from binding to the beta receptors, thus producing vasodilation and decreases heart rate and blood pressure. Beta-1 receptors are in the heart, eyes, and kidneys. Beta-2 receptors are in the lungs, liver, and skeletal muscle. Beta-3 receptors are in the fat cells. An easy way to remember that is you have 2 lungs and 1 heart. Beta-2s are in the lungs and beta-1s in the heart. Examples of beta blockers are atenolol, carvedilol, labetalol, metoprolol, propranolol, and sotalol. They all end in LOL. Non-selective beta blockers block beta-1 and beta-2 receptors. They affect the heart, the blood vessels, and the lungs. Examples are propranolol and sotalol. Selective beta blockers block beta-1. They affect the heart. Atenolol and metoprolol and nebivolol, which is bistolic. Carvedilol and labetalol block both alpha and beta receptors and add to the blood vessel dilating effect. Therefore, especially with carvedilol and the labetalol, you want to make sure the patients eat while taking this medication so it can be absorbed, because it has a stronger effect on the blood pressure because it blocks both alpha and beta. Signs and symptoms, side effects: hypotension, dry mouth, fatigue, and erectile dysfunction. Beta blockers and nitrates are the worst at causing erectile dysfunction. You want to, again, make sure your patients take beta blockers with food to absorb some of the medication, especially carvedilol and labetalol. Treatment for overdose, treat your heart arrhythmias, fluid resuscitation, IV glucagon, gastric lavage, and charcoal. Next, angiotensin II receptor blockers, commonly known as ARBs. And what they do is they block angiotensin II from binding to angiotensin II receptors, therefore causing vasodilation and decreases heart rate and blood pressure. Examples are valsartan, candesartan, irbesartan, telmisartan, losartan, isosartan, and olmesartan. All end in sartan. The side effects: hypotension, cough, fatigue, and hyperkalemia. They can cause hyperkalemia, so patients should avoid potassium supplements and salt supplements. Research has actually shown that ARBs are not only unlikely to cause erectile dysfunction, they may actually improve sexual function. Treatment for overdose, treat heart arrhythmias, fluid resuscitation, and gastric lavage and charcoal. Digoxin and amiodarone are both antiarrhythmics classification. They are used for heart failure and rapid atrial rhythms. Digoxin works by increasing the forcefulness of the contraction. Basically, with every contraction, the heart is able to pump more blood out to the body, getting more bang for your buck, so to speak. It slows conduction between the atria and the ventricles, therefore treatment for rapid atrial rhythms. Digoxin and the Lanoxicap are the examples of those. Side effects: bradycardia, nausea, vomiting, and headache. You have to be careful of dig toxicity, and the symptoms for that are nausea, vomiting, and blurred vision. 0.8 to 2 is the normal level of the dig, so you need to watch out for your patients when they come in with those complaints. Treatment for overdose is IV dingibine. You treat heart arrhythmias, fluid resuscitation, gastric lavage, and charcoal. Dig has little effect on blood pressure, so it's moderately safe to use in patients that have low blood pressure. I'm going to stop, and I'm going to have to do a second one because I am nearing the 10-minute. Although I'm talking fast, I am nearing the 10-minute limit, so I'm going to stop and do a second video as well.